Hi, my name is Maria Kachtorian. I'm a family nurse practitioner student from United States University, class 572. Today's date is August 13th, 2025. I will be conducting a musculoskeletal exam today, but before I do, I'll show you a 360 view of my workspace. All right, knock knock. Hi, my name is Maria Kachtorian. I am a family nurse practitioner student from United States University. I will be conducting the musculoskeletal exam today, but before I do, I'd like to get your consent to record and upload on YouTube so that my professor can grade this. Would that be okay with you? Perfect. So I did my hand hygiene before I entered the room. Can I get your name and date of birth, please?
Arge Vaisropia, February 13, 1987.
Thank you so much, Arge. And at any point you feel any discomfort, let me know, and then we can stop the exam, okay? So we're going to go ahead and start now. I'm going to start by inspecting your hands and your fingers. So I'm inspecting the patient's hands and fingers for any asymmetry, atrophy, nodules, redness, swelling, deformities, or any discoloration. And I didn't see any abnormalities there. Next, we're going to go ahead and palpate. Let me come around this way so that you can have your hands up. We're going to go ahead and palpate your the DIP, PIPs, and MCP joints, which are the distal, proximal, and metacarpal phalangeal joints. So DIP, PIP, and MCPs. So DIP, PIP, MCP, DIP, PIP, and MCP joints. And let me know if there's any tenderness or any pain. Okay, perfect. So I'm not feeling anything for crepitus, any fluid, warmth, swelling, nodules, or any tenderness, okay? And then next we're gonna do the range of motion. I'm gonna have the patient keep her fingers together and then extend them up for me. And then now flex them down, perfect. And then now spread your fingers apart, which is the adduction, and then we're going to put them back together, which is this is abduction and this is adduction. Perfect. And now make a fist for me, and then open, and then fist, and then open. Perfect. So patient has full range of motion without any pain. Did you feel any pain? Okay. So now we're going to move on to the wrists. I'm going to inspect the wrists for any abnormalities like atrophy, any joint deformities, any symmetry, any nodules, redness, or swelling. And then we're going to look. Perfect. And I don't see any of that. Okay, so we're going to go ahead and palpate the metacarpal and carpals. I'm gonna palpate and let me know if you feel any tenderness. Okay. Any tenderness there? So the metacarpals and the carpals, perfect. So I didn't notice the crepitus, fluid, warmth, tenderness, nodules, or any swelling that was noted, okay? Next, we're gonna do the active range of motion. I'm gonna have the patient extend her wrists up to 90 degrees, and then now flex them down at 90 degrees, perfect. And then I'm gonna have the patient turn her hands inward, which is the radial deviation, and then outward, which will be the ulnar deviation. So in and out, perfect. And then full range of motion without any pain. Next, we're gonna do the special tests. There's two tests we're going to perform for carpal tunnel. The first one would be the Tinel sign. I'm going to tap over the patient's median nerve, and then you'll tell me if you feel any tenderness or any pain there, okay? Have you open? Any tenderness? Do you feel any numbness going down? Okay, and then the other one. Perfect. So if this was a positive test, it would be pain there radiating down the palm into the index and middle and lateral half of the ring finger. Next, we're going to do the Fallens test. We're going to place the backs of your hands together, and then we're going to put them like this for 40 seconds, and let me know if you feel any tingling, okay? Any tingling there?
No.
Perfect. So negative for median nerve compression, and a positive test would be pain or parenthesis in the median nerve distribution. Next, we're going to move on to the elbows. I'm going to inspect both elbows for swelling, redness, atrophy, or any deformities like thickening. And I'm going to check. So none were noted. Next, I'm going to palpate them. The olecranon, medial, and lateral epicondyles. Okay, so we're going to palpate them. Any tenderness or pain? Okay. So I'm also going to palpate the extensor surface of the ulnar. Just here. Any pain or tenderness?
No.
Okay. So if the patient has pain at the lateral epicondyle, this is called the tennis elbow. And if the patient would have pain in the medial epicondyle, this would be called the golfer's elbow. Next, we're going to do the active range of motion. I'm going to have the patient extend her arms straight. Do you want to sit that way, and then we can? Perfect, thank you. Straight, and now we're going to bend your elbows for me. And then turn your palms up. You can put it back down. Turn your palms up, which is a supinate, and then turn your palms down, which is pronate. Up again, and then down. Perfect. So full range of motion without any discomfort. Next, I'm going to check the patient's shoulders. I'm inspecting both shoulders from the front and the back. Perfect. So no abnormalities were seen. I'm going to go ahead and palpate all the landmarks. We're going to palpate the shoulder joints and muscles, and then you'll let me know if you feel any pain when I'm palpating you, okay? I'm going to be palpating the sternal notch along and going along the clavicular line, and then we're going to go down to the coracoid process and then the acromyoclavicular joints, okay? So we're going to go down here. So this is your sternal notch. We're going down the corticoid process here, and then your AC joints, and then the bicep groove here. Any tenderness or pain?
No.
Okay. And then down to the subdeltoid bursa. Okay. And then the tubercular humerus. And so no, you said you didn't feel any pain or any tenderness. So the patient, so I didn't feel any tenderness or swelling or crepitus wasn't noted. Next, we're going to move to the range of motion. I'm going to have you put your arms over your head. You're going to flex them at 180 degrees. Okay, let me come by you here. And then now move them behind you and extend them for about 60 degrees. Now out to your side, and you're going to abduct. And then we're going to adduct them and bring them back in, and then bring them all out. Perfect. Perfect. Thank you so much. So next we're going to do rotation, right? Please place the back of your hands as high as you can and behind your back, as if you were trying to reach up behind your shoulder blades. Perfect. This assesses internal rotation. And do you feel any pain? Perfect. And then external rotation. Now we're going to have the patient place hands behind her head with elbows pointing out to the sides. Perfect. This assesses the external rotation. Do you have any pain? And then we're gonna have you extend them out like to the back. Perfect. So full range of motion was observed with no pain reported from the patient. Next, we're going to do the drop arm test. I will be testing the patient rotator cuff. I'm going to have her rotate her elbows back and then ask to raise each arm one at a time to shoulder height and then slowly bring them down. So I'm going to bring them out and then slowly bring them down, and then you can do that the same with the other hand. Perfect. So the patient is negative for drop arm test because her arms didn't suddenly just drop down. Next, we're going to move to the head and neck. I'm going to inspect the head and neck for posture and any deformities. Let's see. Perfect. So the posture looks normal with no deformities. Next, we're going to check if you want to turn, yes, where's me? I'm going to cut this way. We're checking for TMJ. I'm going to palpate and then open and close your mouth for me. Perfect. Now move them side to side. So we're checking the jaw joints. Perfect. So no clicking or pain was noted. You didn't feel any pain there, right? Okay, perfect. So next we're gonna palpate the cervical spine muscles. I'm gonna have you turn the other way for me. You wanna turn this way. So tell me if you feel any pain or tenderness, okay? So I'm palpating the cervical, the paracervical and sternoclavicular regions, which would be the trapezius muscles and the rhomboid muscles, okay? Then we're gonna palpate. Do you feel any pain, any tenderness? Okay. Perfect. So there's no swelling, no deformities, and no muscular atrophy. Next, we're going to do the active range of motion of the neck. We're going to have the patient flex her chin down to the chest. You want to turn, or it doesn't matter, it could be either way. So turn your, yeah, there you go. We're going to have her flex her chin down to the chest, extend up, and then turn head to the left, and then to the right. Perfect. And then ear to shoulder, let's do that. And the other side. And any pain when you're doing this? No. Okay, so full range of motion without any pain. Next, we're gonna do the spurling test. We're gonna have the patient extend her neck and then lean, and then I'm gonna, perfect. And then to the other side. Any pain or tenderness there? No. Perfect. So negative for cervical nerve compression. Next, we're going to move to her spine. I'm going to be inspecting the patient's spine anteriorly, laterally, and posteriorly, while the patient should be standing. Let me have you stand for me. Okay. This back for now. Okay, so we're checking. I'm just going to inspect. Okay, perfect. So, what are we doing here? There's no cervicular or lumbar lordosis or dorsal kyphosis noticed. Shoulder height is symmetrical and iliac crest symmetrical. Skin creases below the buttocks symmetrically. Next, I'm going to check for symmetry of movement. Shoulder height, hip height, curve of spine for scoliosis. So I'm going to have the patient slowly move forward as far as possible, and then we're checking here. Perfect, thank you. Next, I'm going to be palpating the spinous processes, which are the intervertebral spaces. And I'm going to palpate here if you can. Perfect. Any tenderness or pain? So I do not see any deformities, any nodules, any muscular atrophy. No tenderness was noted, or swelling or abnormal findings on upon palpating her. I'm going to percuss the spine using my ulnar surface of my fist. Let me know if you feel any pain, okay? Any pain? And do it on this side. Any pain or tenderness? Okay, perfect. So no pain or tenderness was noted. Next, we're going to move on to the active range of motion of her spine. Please bend forward at about 90 degrees for me. Perfect. And then you can come back now. And then we're going to do side to side. So I'm going to have you move to the side and then to the other side, which is about 35 degrees. And then twist at your waist at 30 degrees. Perfect. Now the other side. So full painless motion was noted. Next, we're going to do the specialty tests, which is called the straight leg test. I'm going to have you lie down here. Okay, perfect. So the straight leg test rise. I'm going to have you raise your leg one at a time for me. Any pain? Okay, the next one. Perfect. So no nerve compression, sciatica was observed, okay? So next we're going to move on to the hips. I'm going to inspect her hips for any swelling, nodules, redness, and for alignment. For the purpose of this video, we're not going to have her remove any of her clothes, so we're just looking over the clothes here. We have the patient supine and her legs straight together. Perfect. And I'm just inspecting. So iliac crests are level, no swelling or asymmetry seen. Next, I'm going to palpate the anterior superior iliac spine, which is here. Let me come on this side, sorry. Sorry, is that ticklish? And then the posterior.
I'm okay.
Okay. Perfect. I'm just inspecting here. You okay? So I was palpating the anterior superior iliac spine, the greater trochanter, posterior superior iliac spine, and the sacroiliac joint height of the hip is equal. No deformities, no nodules, and no abnormalities were noticed. No pain or any tenderness then, right? Okay. Next, we're going to do the active and passive range of motion. I'm going to rotate your hips outward and then inward, and then repeat on the other side at 45 degrees. Okay. So we're going to move inward, outward, and then we're going to repeat on this side, inward, outward, and then now you're going to do it yourself. So inward.
Oh,
Sorry, let me move out of the way. Out, and then you're going to repeat in and out. Okay. So so now we're going to flex each hip up and back down. So let's flex each hip. There you go. Up and back down, and then up and back down. Perfect. So abduction, we're going to bend the leg and your knee, abducting 60 degrees and then adducting at 30 degrees, okay? Next, we're going to move on, which we did already.
Yes.
So next, we're going to do the special test, which is the Patrick's or Faber test, Patrick's test, the sacroiliac joint. It's the sacroiliac joint disease test, okay? We're going to do heel to knee test. And then I'm going to press down on your knee. Like this, and then I'm going to push down. Let me know if there's any pain or tenderness. Perfect. Now the other side. Any pain or tenderness? Okay, perfect. So next we're going to move on to the Thomas test. I'm going to bring one knee to your chest. And while you're just going to stay relaxed, and then we will check the other leg if the other leg lifts up, okay? So I'm going to bring this up. And as we see, the other leg didn't lift up. Now we're gonna do that for the other side. Make sure you're showing. Okay, perfect. Down. Okay, so both tests were negative, and she didn't have any pain, and there was no pain noted, right? When hyperflexing your hip. Next, we're gonna move down to your knees. We're inspecting the knees for any swelling, nodules, redness, alignment, the valgus or varus deformities, okay? And as we look, her knees look symmetrical and with no swelling or redness. And then I'm going to palpate them and let me know if there's any pain or tenderness, okay? So,
Sure.
and I'm checking for any tenderness around your suprapatellar pouch, side of the patella, the popliteal fossa for any Baker's cyst. Okay, and then we're gonna go on to the range of motion. We'll have the patient again stay in supine position, and then I will have her bend her knees at 20 degrees, and then extend. Just put them at 20 degrees and then extend them. Okay.
One leg at a time.
One leg at a time. So 20 degrees, and then you can do it. Perfect. Next, we're gonna do the stability and the meniscus test. I'm going to apply like a gentle pressure side to side for the varus and the valgus stress test, which it involves applying, pulling the varus inward, and then we're going to force the knee while the leg, force it in while the leg is extended at 20 degrees, and then 20 degrees of flexion. So what I'm going to do is, let me just show you what I'm going to do. I'm going to lift here, and then I'm going to push in, and then now the valgus, I'm going to hold here, and then push out. Perfect. And then we're going to do the same on the other side. And then here. Perfect. So, and did you feel any pain or any discomfort? Okay. So we did both the valgus and the varus test. Okay, we checked both in and out. Now I'll perform the McMurray test for the meniscus tears, and then to check that, we're looking for laxity, pain, or crepitus, rotating the knee inward and then outward. Okay, about the same. Any pain or tenderness? And then on the other side. Okay. Anything feel loose? Okay, perfect. So the patient has no signs of pain or tenderness when applying pressure there. And now we're going to do the Lachman test by placing my hands. I'm pressing the tibial and my opposite hand just supporting the leg and trying to push anteriorly and posteriorly while checking for ligament laxity or collateral laxity. And okay. Any pain or tenderness there? Next one. Any pain or tenderness there? Okay. Then for the drawer test, we're going to stabilize leg at 90 degrees. And then for this one, I would need to sit on the patient's feet to place my hands on anteriorly and posteriorly on the knees and apply pressure and pull, and then I'm going to pull looking for any abnormal movements, and then you'll let me know if you feel anything that's loose, okay? So I'm going to sit on your feet. Do you feel anything loose or pain or any tenderness? We'll do the same on the other. Nothing? No. Perfect. Okay. So, sorry. So no anterior posterior ligament laxity, which is a normal finding. Next, we're going to move on to the ankles. I'm going to inspect the patient's ankles for any swelling, deformities, nodules, or discolorations. And we're looking. Okay, so I'm going to go ahead and palpate the medial, lateral, and malleus and Achilles, which is back here, tendons, okay? Any tenderness back here? No? Okay. Perfect. So no swelling. I'm going to check the other one too. Okay. So no swelling or redness or any deformities, nodules, or any discoloration was noted. Next, we're going to do the range of motion of your ankle. So I'm going to have the patient point. Let's have you point your toes up, and then which is the dorsiflex, and then down, which is the plantar flex. Perfect. Now make circles for me. Perfect. Perfect. Okay, so next we're going to do the feet and toes. I'm going to inspect the feet and toes for any bunions, corns, or plantar warts. And as I was looking, there was none noted already. Please curl your toes for me. Perfect. So we're going to curl them, and then we're going to pull them down and up. Perfect. Next I'm going to palpate your feet and your toes, the distal and proximal interphalangeal and metatarsophalangeal joints, okay? Any tenderness or pain? So for this, we're doing the DIP, PIP, and MTPs, okay, for your toes. DIP, PIP, MTPs. Any pain, any discomfort? Okay. So then we're gonna palpate the interdigital neuroma, which is the Morton's neuroma. It's between the third and fourth toe, okay? So the third and fourth toe here. Any discomfort or pain? Okay. So next we're gonna be palpating for plantar fasciitis. It's the heel and it's the heel of your feet. For any arc pain due to any inflammation of the plantar fascia, so like a thick band of tissue on the bottom of the foot would be there, okay? And none was noted. So we also checked for flat feet before the recording, and the patient does not have any flat feet when you were standing, okay? Next we're going to do the range of motion, which is the flex. You're going to curl your toes, and then we're going to have her extend their toes, and then invert, and then evert them, okay? So curl, extend them, and then invert, and then evert them. Perfect. So full range of motion without any pain. Did you feel any pain or any discomfort? Okay. And this concludes the musculoskeletal exam, and you had a full symmetric range of motion with no pain, no abnormalities were found, and that's it. We're done with our.
Thank you.
Thank you so much.